Welcome back to Africa This Morning. We are now on Table Talk. Today is World Cancer Day, and joining us to discuss cancer on Table Talk is Dr. Ahmed Komen. Thank you so much for joining us.
Thank you.
As an oncologist, what does Not Beyond Us mean to you as the theme of 2015?
Yeah, Not Beyond Us actually is the theme that was coined by the World Cancer Organization, and that is under the UICC. And what that means actually, the theme for this year is that we should not take cancer as something that is beyond us. And we actually have the tools to control this disease, which is, as we all know, that it's becoming very common actually. And in Not Beyond Us, they've mentioned a couple of things that we can actually do to reduce the cancer burden that we are seeing not only in Kenya but world over, and especially in developing countries. And one of the things that we can do, they've mentioned there, healthy lifestyle is one of the most important things that we can do to reduce cancer burden. And by healthy lifestyle, actually we are able to reduce cancer burden by 50%. So you can imagine, by just changing your lifestyle, the burden of this disease that we can be able to reduce. Other things that have been mentioned by Not Beyond Us is the prevention ways like screenings, which can help us actually detect this disease when it's still very small, and hence we are able to give curative treatment. And other things is the early detection that I've just mentioned, and also treatment for all. As we all know, many people out there, when they get this disease, cancer treatment is not cheap. It's very expensive, and most people are not able to afford our treatments because of finances and all that. From this theme, we know cancer is not beyond us, and we need to actually make sure that everybody gets this treatment, and that is what is called treatment for all. And just one last thing that actually the theme for this year is talking about is improving the quality of life for people who are actually suffering from cancer. Because from what we all know is that when the patients come to the hospital, we normally assess them, and sometimes, which is very common in this country and most African, developing countries, is that patients come to the hospital when the disease are spread, when it's very advanced, and most of the times we are not able to give curative treatment, and all we can offer is what we call palliative treatment to improve their quality of life.
When you're looking at the theme Not Beyond Us, how is it that we can move the campaign from the day into a customized front so that every country takes it up as a responsibility, and for the individuals within the countries that are going to be commemorating, which should be an international commemoration day, how are we going to personalize the theme so as not to move ourselves into a rut of always just commemorating the World Cancer Day, having a theme in, year out?
Yeah, actually this theme, World Cancer Day, it's celebrated world over. And the theme is coined, like I mentioned, by the UICC and the World Cancer Organization. And every year they choose a theme, actually, that will suit and be able to, because like you know, the aim of the World Cancer Day actually is to take this message to the individuals, community levels, and also at national levels. And by sensitizing the public about cancer, we'll be able to, what the outcomes that we're expecting actually is that once many people are aware about this disease, they are able to recognize whether they are asymptomatic, they don't have any problem, they would be able to come for screening. The other thing is that if they have symptoms, then they would be able to go to the hospital early. And all these, actually, the aim of getting the disease early or being screened is to be able to detect this disease early.
Sensitization is a conversation that's a bit tricky for the Kenyan population. Right now we have about 39,000, if not over 40,000, as we were talking about earlier, over 40,000 people who are listed to have contracted cancer or have cancer in Kenya, and 27,000 of those die annually. How are we getting the conversation out so that sensitization is not an issue of emergency at the very tail end of the situation of the condition?
Yeah, like you've mentioned, sadly, it's that we do not have proper statistics in Kenya, just to mention. All these are estimates, and from what we know is 40,000 cancer cases is a lot. And like I mentioned, our major problem is that you see, like from the figures you're giving, 27,000 people die annually from cancer. The reason for that is because they always come late to the hospital when the disease has spread, and all that, and all can be offered is just to improve their quality of life and not to cure the disease. And from that you can see it's only 13,000 people. These are just estimates that are able to survive after contracting this disease.
What is the
and
challenge?
What that means actually is that most people really do not recognize that they need to go for screening, especially for common cancers that we know has reduced mortality world over, like cancer of the cervix, colon cancer, and
Prostate cancer and breast
one
cancer.
other important thing is breast cancer, which is very common, and prostate cancer, which is a little bit controversial actually, whether patients should get screening or not. But yes, also for prostate cancer screening. So if we are able to take this message to individuals and community levels, they'll be able to come to the hospital early. And hopefully we will be able actually to reduce this mortality from the 27,000 you've just mentioned to slightly lesser than that.
What is the challenge as a healthcare provider in terms of sensitizing every walk-in patient to be more conscious of the reality of cancer without getting them to that point of paranoia?
Yes.
Just as a package, a healthcare package within the institutions.
To help them with the
sensitization right from the moment they walk into the healthcare center.
Yeah.
What is the challenge among healthcare providers in terms of offering this information as a healthcare package?
Actually, the thing about the challenges that one thing I could mention that we often see is that like we know we have very few oncologists in this country, we can count them, and most of the time these patients are seen by general doctors, and most of these we know the comprehensive cancer treatment in Kenya is only found in Nairobi and not anywhere else outside Nairobi. We have Moi Teaching Referral Hospital, but they just offer a section of cancer treatment. They do not have radiotherapy unit in that end. And most times these patients, they would get diagnosed away from Nairobi, and even the distance of them coming from other parts to Nairobi takes quite a long time. They have to reorganize themselves. And we know the other major challenge also is that by the time these patients come and see oncology and get proper information and get diagnosed and treatment, it takes quite a long time. And so that is one of the major challenge, patients coming very late because of delays and all these kind of things. And the other thing is also our community. There are still patients that I have seen in my practice getting other treatments before getting the conventional treatment in the hospitals. So you will see patients being diagnosed with cancer, and immediately they're told you have cancer. The second thing is that they know there's no cure, and there's no need of going to doctors and spend much and all that, and they would go to they will seek alternative treatments. And by the time they come to the hospital, like I have an experience of one of my patients who came actually 2 years later after being diagnosed with cancer from Eldoret. And we see that the community need to know actually that coming to the hospital early, they can get curative treatment. And most cancers actually, when they're detected early, they can be cured.